Senator Roberts.
Minister, can I now refer you to graph 1.3.7? Prevalence of current smoking in Australia, United States, England, United Kingdom, New Zealand and Canada. This graph shows the steady, not accelerating, the steady reduction in smoking rates has occurred not only in Australia but other Commonwealth countries and at about the same rate. Minister, is this more proof that scary pictures are a stunt and something else is behind the reduction in smoking?
Minister. Chair, I refer to my previous response. Thank you.
Senator Roberts.
Let's change topic then. To review, the government has no idea what works and what doesn't, and no new ideas. Just more of the same, which of course keeps public servants and non-government organisations in a taxpayer-funded job for another year. Minister, your no new ideas, more of the same failed policies approach costs the taxpayers how much? How much is spent on the anti-smoking industry in Australia every year? The anti-smoking industry.
Thank you, Chair. Well, I totally reject the Senator's accusations that we have no new ideas when we are trying to improve the lives for Australians in this country, especially youth, especially children. We see this in our schools, Senator. So please, do not come in here and say we have no new ideas. We know that the cancer rate in this country is the leading cause of disease. We know that lung cancer is the lead cancer for that. So these laws, let me remind the Senate, is about plain packaging. It's about ensuring the safety of our young children, our young Australians, so that they do not get caught up in a world, which is quite easy to do so, of smoking tobacco. We have to be sure that the plain packaging here, through this legislation, makes a very real difference to the lives of our fellow Australians.
Senator Roberts.
Thank you, Minister. I happen to like you and respect you, but your use of emotion and young children does not cut it. This is my point. The government has committed $511 million over the forward estimates and $101 million ongoing towards a range of measures calculated to help reduce smoking and vaping. These consist of $264 million over 4 years and up to $101 million per year ongoing to establish and maintain a national lung cancer screening program through which at-risk Australians will be able to get a lung scan every 2 years. $141 million over 4 years to expand the Tackling Indigenous Smoking program to include tackling vaping. $63 million over 4 years for national public health campaigns to discourage people from smoking and vaping, including additional funding provisioned in the contingency reserved for a targeted youth campaign. $30 million over 4 years to increase and enhance smoking and vaping cessation support, and $13 million over 4 years for legislative and regulatory reform, as well as testing tobacco products for prohibited ingredients and increasing inspections of manufacturers, importers, wholesalers and retailers of tobacco and vaping products. Wow, that's an industry. $500 million over the forward estimates, half a billion dollars. It's an industry and it's being protected by worthless measures like the ones this bill is proposing. Thousands of bureaucrats, non-government organisations, not-for-profits and miscellaneous opportunists are kept in a job by the size of the government spending. This will do nothing to reduce smoking. We've already seen the data from your own department. It says that it's just decelerating at a steady rate, not accelerating. It's just decelerating, just decreasing at a steady rate, the same as overseas other countries. Minister, was this bill designed, but this bill will guarantee all these measures will be funded for another 4 years, despite doing nothing to reduce smoking. Minister, was this bill designed knowing it would keep the anti-smoking industry in work for another 4 years?
Minister.
Thank you, Chair. Well, I totally reject from the outset your accusations that this will not do anything to assist our fellow Australians. You know, The fact that we do have to put $263.8 million for a new national lung cancer screening program should say something in this debate, shouldn't it, Senator? And the fact that we're putting $238.5 million to support the Aboriginal and community-controlled health sector, I would not say that that is a worthless approach and initiative to try to decrease the amount of cancer rates and smoking amongst First Nations people in this country. So I totally reject your allegations.
Senator Roberts.
An emotional argument does not take the place of data. The excise— I've never had a cigarette in my lips. Never. My children have never had cigarettes either. The excise on tobacco products— let's move to the real cause of what's needed here, of what's driving decreases. The excise on tobacco products has been steadily increasing every year, coinciding with the reduction in smoking rates. Senator Canavan talked about it. In Turkey, which I mentioned before had the highest smoking rate in the developed world, a 20-pack of Marlboro cigarettes costs $1.62 American. That's for a whole pack of 20, not for a cigarette. In Australia, that same pack is $25.88 on a best comparison basis. The next dearest country for smoking is the United Kingdom, where that same pack costs $15.83. We are more than 50% dearer than any other developed country for cigarettes, and the price has been going up steadily in proportion to the reduction in smoking rates. Minister, isn't it true that the real reason smoking rates are falling is because they get dearer every year, and the real reason the number of people giving smoking away is decreasing slowly is because those smokers who are left can afford it more?
Minister.
Thank you, Chair. I just remind the Senator and the Senator that this is a public health policy and we are talking about plain packaging.
Senator Roberts.
I'm talking about the industry that the bill will feed and continue to feed. Minister, I note that the explanatory memorandum and second reading speech both try to make the point that Australia is falling behind other nations. Actually, amongst developed nations, Turkey has the highest smoking rate of 41% amongst males. Australia, with 12%, is 29th. Only 8 nations have a lower smoking rate than we do. Only 2, Iceland at 8% and Norway at 6%, are significantly better. Clearly, the contention that Australia is falling behind the world is outright misinformation. We are close to leading the world. For clarity, we are close to leading the world because we have priced cigarettes into the stratosphere, not because of scary pictures on boxes or the other Roxon measures. Minister, is this legislation just more of the same to keep the Labor-aligned anti-smoking industry going, while at the same time allowing your government to go to the electors and pretend to have done something about smoking? Is this why you exempted yourselves from your own misinformation bill?
Minister.
Thank you, Chair. In 2011, we did lead the world under Nicola Roxon with these reforms that came through both this House and the other House. And certainly for the past 9 years, we've needed more work done. And we know that that's why we're bringing in this next critical step in the fight against tobacco and nicotine addiction. And I just urge the Senator and the Senate to remember that this is why we're here. It is about plain packaging in this legislation, so that we can be, once again, world leaders in the way that we conduct ourselves in terms of this public health policy.